Hello, I'm Patrick. I'm the osteopath here at Hands On in Cheltenham. This little segment here is going to be about a special type of shoulder pain, which actually involves the neck. So there's a lot of neck problems which can manifest themselves as pain in the shoulder, particularly the shoulder blades behind the back, and actually the shoulder girdles and complex here as well. And there's a very sound biomechanical reason behind these pains we'll go into. But the important thing about these is that they're really, really treatable. There's a very simplistic reason they exist, and you can do a lot about them, both from a manual therapy or massage side of things, and from a self-help and directed exercise point of view as well. And you needn't suffer with these at all. They're very, very easy to get rid of once you're aware of them. So, what drives these sorts of problems, first of all? And what drives them actually is the position of the head and shoulders relative to the weight and the pull of gravity. So if I show from the side, our common desk-based posture we all have these days, it makes it a bit clearer. So once your head starts to come forward, the shoulders come forward with them, the muscles here on the back of the neck and shoulder, the trapezius, have to work quite a lot harder to maintain my head against gravity than it does when I'm here. Here I'm actually putting the weight of my head more on the bony column here of my spinal column. That's really easy on the muscles. This here is actually really hard on the muscles. It takes a lot of effort to maintain that position from those trapezius muscles in particular. Now if that trapezius gets overworked, it gets tired, it can't get rid of its wastes very well, it can become quite irritable, it can become very tight and clamped down on the neck. When the neck becomes clamped down, you start to get some irritation, perhaps some impingement even, onto the cervical, some of the cervical nerves in the neck. Now these nerves are important because they actually supply the skin and the innervation to the muscles of the shoulder girdle themselves. So that means you can start to feel pain in those supplied areas, which is what's called referred pain. Now we're not talking about a pathology or like a disc type lesion. This is just a mild irritation of that nerve somewhere along its course from the side of the neck out towards the shoulder. And there's lots of different sites that can be impinged and cause pain, but certainly one that's very common is around this sort of area here, as a group of muscles here called the trapezius and the scalenes, which often become quite tight and they squeeze those nerves together. Now this is a muscle tension sort of problem, and if you work on it from a muscle tension point of view, if we get rid of the muscle tension, open those spaces up to allow those nerves to pass freely through, that oftentimes does a really good job at getting rid of that referred pain. Now it also will address the postural aspect of getting your head back over your chest, which relieves some of that acute muscle strain on the old traps up here as well. So a couple quick exercises that I prescribe to my clients for this. Really effective, something you can do at work, at home, whenever you like. Involve strengthening up the front of the neck here and between the shoulder blades in the back. So really simple, really effective. So let's kind of go through those now. They're really, as I said, pretty easy to go over and go through. So the first one's going to be focusing on the chest and the shoulder blades themselves. It's going to be sat in your chair thinking about puffing your chest out, a bit like a pigeon, holding it for a count of 5, and relaxing back down again. Okay. From the side, you can see that as I focus on puffing my chest out, actually my head comes back. And as you relax, if I was here, if I focus on bringing my shoulders back and chest out, naturally it wants to come back. So it's a very, very simple way of focusing on realigning that head over your shoulders. The next really simple one to do is a chin tuck exercise, which is focusing on tucking perhaps a tennis ball or a hockey ball under your chin. So a little tuck and hold. Now the best way of doing this actually is, again, overdoing the wrong activity by going way out here and then tucking back. So this is my ball here. I'm going to overextend, come back, and tuck. Okay, overextend, come back, and tuck. Okay. Keep it nice and slow and steady. With both of those, it'll develop your proprioception of where your head is in space, so you can start to be more aware of where your posture is and correct it when you're doing something wrong. Get yourself back to where you should be. Take the stress off of these muscles up in here, and that'll get you down the road to some nice pain-free recovery.